would be just starving myself. So after 3 weeks of doing it diligently, and then on the advice of my doctor who believes in the root cause treatments, she put me on a carnivore diet, even with all of the heart problems I had. My A1C was out of control. And after 3 weeks of taking the FGS, my triglycerides went from 630 to 105. And
Can you say that again, Rob?
they went from 630 to 105. But what you don't know is back when I had, back in 2012 and when I was first diagnosed, my triglycerides were over 3,000. That's what a lot of people
It's
don't
insane.
realize that. They were in the thousands. So no wonder I had so many clogged arteries.
Mhm.
And since I've been on the field grade system, I've gone down to a 32-inch waist. I've lost probably 20, 25 pounds. I've got a picture. Shannon's got some
Yep.
pictures that I was in the hospital in the ICU, and I've still got this big, fat, full face. And then this one was just a couple of months ago. I'm actually wearing the same stuff. Go figure. But I've managed to keep the weight off. The triglycerides are still down. My A1C is not where it needs to be, but it's a lot lower than it used to be. My inflammation is like zero point 0.4. It's almost non-existent because I don't eat all the processed foods and all of that. I've not missed one day of work from the heart trouble. Um, my glucose is well controlled, and it's all because of this system. It's amazing what it does if you just give it a try. We're not told about diet and natural remedies. And this, if you have metabolic disease, heart disease, diabetes, high blood pressure, it's amazing. I've lost weight. I'm off 3 of my 4 blood pressure medications, and the results have just been phenomenal.
Wow. Well, thank you so much for sharing your story, Rob. I mean, guys, this goes to show you that even us healthcare professionals, Rob is a nurse, we don't know it all about nutrition. We've all come from the old school where we were taught, to eat every 2 to 3 hours, that salt is
Mhm.
bad, that eggs cause high cholesterol and clog your arteries, and that red meat is not good. But all of us are learning and now we know better. And so we're continuing to learn. And the more we learn, the better we can do. So thank you so much for sharing your story.
Mhm.
Tonight, we are going to learn from a pharmacist about medication and how the medication can keep you stuck in a hamster wheel where you don't know how to get out. The medication that you take to make you better is really making you sick. Now, I just want to preface this that we are not your doctor. We are not your healthcare providers. We are solely here to show you what is possible, but please go to your doctor and consult with them before you make any of these changes. But I want you to leave this call tonight knowing that there are other options and that you can get better, that your chronic disease is not your identity, nor is it your destiny. Okay. So I really want you to embrace that. Ask questions in the chat if you have them. And now I am going to welcome Amanda Yue. And actually, I'm going to make you full host, Amanda.
Thank you, Shannon.
Oh, you're so welcome. Let's see.
I just want to say, yes, congratulations. Wow, Ashley and Rob. I mean, that makes me happy as a pharmacist on a regular basis. I dispense on average 5 to 10 medication per patient. So the fact that Ashley's able to find solution for trigeminal nerve pain, that's amazing. That's amazing. So I'm so happy that you are here. Let me share my screen. All right. Can you see my
Yep.
slide?
Yep.
That good? Okay. All right. Shannon said, if you don't know me, my name is Amanda. I am a PharmD, but now known as the root cause pharmacist. Yes, I've gone rogue in the best way. Let's start with the problems. We have big problems, right? We're facing an epidemic of type 2 diabetes and obesity. Let me just move this real quick here. All right, yeah. All right, so obesity has reached an epidemic levels, not just in here in the US, but around the world. Over 1 billion people worldwide are now classified as obese, and over 500 million are living with diabetes, and vast majority is type 2. These conditions, I'm not talking about type 1, I'm talking about type 2 diabetes and obesity. They don't just coexist, they feed each other. Excess body fat, especially around the abdomen, lead to insulin resistance. All right, so here is the prevalence of type 2 diabetes on the rise, as you can see, since 1958. And statins and metformins have been around for over 30 years. I've been a pharmacist for over 30 years now. And if these medications are working, we should not be seeing this type of data here. So type 2 diabetes is no longer a disease of old age either. It's a full-blown epidemic impacting younger and younger populations. We're seeing more people diagnosed in their 30s, even teens, and in children. This isn't just about blood sugar. It's about insulin resistance and our modern environment that our bodies are not designed for. Here, I'm sure you've seen this before. I don't know how many people are new here. We have this call on a weekly basis. So here, approximately 98 million American adults are living with prediabetes, and more than 80% of them don't know that they have it. All right. I borrowed these slides from Dr. Bickman from our RISE event last Friday, or this past Friday. Most people, well, let me see here. Okay. All right. So what you're seeing here, you're looking at a timeline here. And it tells a story that most people never hear. On the left side over here, insulin levels are already rising, right? That's the very beginning of insulin resistance. And it doesn't happen overnight, guys. It usually triggers by years of ultra-processed foods, chronic stress, poor sleep, and inactivity. Here's the tricky part. Your blood sugar, A1C, can stay perfectly normal for years. But the truth is, insulin resistance can be brewing for 10 to 15 years before you ever see it reflected in your labs. Why? Well, because the body is compensating. The pancreas is working overtime, pumping out more and more insulin to keep blood sugar stable. So on the left side here, you can see the insulin is rising, but blood sugar is still staying low at a normal level because while insulin keeps creeping up. So this is what we call the silent phase. You go in for a checkup, right? Your A1C is tested and it looks great. You're told everything is fine, but underneath, damage is already happening to your arteries, to your brains, to your liver, to your hormones. During this phase, you might be told that you might have high blood pressure, you have high cholesterol, you're gaining weight, or you're constantly fatigued. But since your A1C is still in the normal range, you're told, oh, you're fine. Just keep an eye on it. No real action needed, right? How many of you guys been told that? But what if you ask for a fasting insulin, right? If you were to test a fasting insulin, you'll likely see a problem long before blood sugar ever goes up. Eventually, after years of compensation, the pancreas becomes so exhausted and the cells stop responding to insulin. Now is when you get to an elevated of A1C and you get a diagnosis of prediabetes or type 2 diabetes, as you can see in the graph here. So insulin is working really hard to bring down glucose until it can't anymore, and then you get a diagnosis of type 2 diabetes. that's when insulin stops not working as well. Okay, so the cells are now not responding to insulin as it should. So that's why we don't wait for a high A1C. You don't want to wait until you get a high A1C. You want to pay attention to the earlier signs and high triglycerides, your weight gain, your high blood pressure, chronic fatigue, and take actions before your A1C ever get elevated because healing is so much easier and more effective when we catch it early. So here are some of the diagnoses that are related to insulin resistance. I'm sure you've seen this picture, this diagram before, right? Insulin resistant has its hands in almost every major chronic conditions, and I dispense medication to treat each one of these. And like Rob said, 3, 4, 5 blood pressure medication attacking to bring down blood pressure from different mechanisms. Where if we address insulin resistant, we can resolve most of these conditions. All right, let's see. So let's see where here. All right, here we go. So common drugs that are linked to insulin resistance. So the first one is a steroid, all right, like prednisone, dexamethasone, hydrocortisone. These are prescribed to reduce inflammation and suppress the immune system. Why they are life-saving in acute situations, repeated use, chronic use will lead to high glucose levels due to promoting of glucose neogenesis, so glucose production in the liver. The beta blockers and the thiazides, these are blood pressure medications. So the beta blockers, how this can contribute to insulin resistance is that they decrease glucose uptake in the muscle. And the thiazide, they deplete your potassium levels. And of course, statins, I'm going to go over statin in more details. Statins are the most prescribed medication for cholesterol. But what statin does, it can impair glucose metabolism and increases HbA1c, directly put you at risk for more insulin resistance and type 2 diabetes. Antidepressant, yeah. These medications, these medications can increase your appetite, and some of them are obesogen, and which leads to weight gain. So statins have been the go-to drug, right, for lowering cholesterol for decades. So over 200 million people worldwide are prescribed statins. Heart disease is still the #1 cause of death, guys. So if statin has been working to reduce heart disease, we should not be seeing this kind of statistics. Statin lower cholesterol, but they don't address the root cause. So according to the American Heart Journal, most heart attacks occur in people with normal or near normal cholesterol. So the cholesterol is not the villain, okay? We need cholesterol, right? For brain function, for hormone synthesis. So how does statin contribute to insulin resistance and weight gain? So first, when statin blocks the CoQ10, which is critical for mitochondria energy production. When mitochondria are underpowered, your body can't produce energy efficiently. And the result, of course, fatigue, reduced physical activity, and slow down the metabolism, setting the stage for weight gain. Statin also impairs how cells respond to insulin, especially in the muscles and in the liver tissues. So this drives insulin resistance. Your body needs to release more insulin to do the same job, insulin resistance, right? And as we know, more insulin equals to more fat storage, especially around the midsection, which is one of the 5 markers for metabolic syndrome. Research shows that statin increases fasting glucose. So this is a direct side effects of statin, increases your HbA1c. And you can find this in the drug insert directly. This is one of the side effects, okay? This means a person can move from pre-diabetes to type 2 diabetes while being on statin. So statin is supposed to protect you, protect you from having a cardiovascular event, but it sets you up for insulin resistance and type 2 diabetes, and type 2 diabetes itself is one of the strongest risk factors for cardiovascular disease. So now we're just stuck in this vicious cycle. Remember, cholesterol is the building block for testosterone, for estrogens, and for cortisol, right? When statins lower your cholesterol too much, hormone production drops, so low testosterone. I see men, younger men, not just elderly, younger men come to the pharmacy for testosterone injections and creams. And low testosterone will lead to muscle loss and fat gain. Again, slowing down your metabolism and increased insulin resistance. Statins can trap you in this cycle of insulin resistance, weight gain, more inflammation, higher insulin resistance, and more fat storage. So you can see this cycle, this vicious cycle, right? So another drug I want to expand upon is metformin. Why metformin can keep you stuck in this weight gain cycle. Let's take a look here. So metformin is the most prescribed med for type 2 diabetes. On the surface, metformin looks like it's a helpful tool, right? It lowers blood sugar. It can improve insulin sensitivity. It sometimes suppresses appetite. That's why it's often assumed to help with weight loss. But here's the catch. Long term, metformin can actually block weight loss or even contribute to weight gain for some people because it interferes with the body's energy and metabolism in a deeper way. So let's talk about what's happening underneath the surface. When someone is on metformin long term, and many people have been on it for years, like my mother-in-law, over 15 years, metformin reduces your mitochondrial function, just like statin. That means your body's energy factory slows down. With less energy being produced, metabolism slows down and people feel more tired, making it harder for you to move and exercise and burn fat. It also suppresses the thyroid. So this is another that people don't talk about, okay? Particularly the active form of thyroid, the T3, the free T3. The active form, when your thyroid produces hormones, it produces an inactive form, which is the T4. T4 gets converted into the active form of T3 via your gut, via your liver. How many people do you know have gut issues and liver congestions? Many. All right. So it's a problem, it's a big problem that's under diagnosed. When T3 is low, weight loss become weight loss becomes harder because T3 controls your metabolism. So metformin also have shown to increase cravings, especially for carbs due to disrupted energy signaling and nutrient deficiency, like B12 and folate, and of course, leading to neuropathy because folate and B12 is needed for nerve function. Let's see. It also disrupts gut mitochondrial, gut microbiome, I'm sorry, which plays a big role in hormone regulations and blood sugar control and inflammation. So a disrupted gut can send the wrong signal to the brain. Remember, 90% of your serotonin are being produced in your gut. And this itself help fuel more insulin resistance. So instead of solving the problem, instead of addressing the root cause, we have been using medication to treat the symptoms, and we get stuck in this cycle of insulin resistance, leading to all these diagnoses and just keep us stuck in this pharma loop, right? So how do we get out of here? How do we break away from this loop and get off this merry-go-round? Shannon will talk about the protocols that we have. So to get from here to here, we need to address the root cause. We use the Feel Great system as our tool. And this is how I was able to help my mother-in-law reverse her type 2 diabetes after being a diabetic for over 15 years. And she was on a statin for over 20 years. She was diagnosed with showing signs and symptoms of early signs of Alzheimer's dementia a year and a half ago. And with this protocol, she was able to lower her triglyceride from 242 to 99, improve her HDL, and she was able to get off the wheelchair. She lost 20 pounds and lower her A1C. And her memory is returning. She's back to her old self. So thank you.
Thank you, Amanda. That was amazing. Let me get back in here. Okay, there we go. Awesome. Well, guys, we will have Amanda back on at the end. If y'all have questions, just remember, we can't recommend anything as far as starting or stopping medications, but we can give you some general information. So I am going to talk about alternatives to medication, right? What can we do naturally? What is within our control to address all of these issues that are affecting 93% of us? So let me share my screen. Okay. Awesome. All right. Can y'all see that? Amanda, can y'all see that? Nod, because I can't see y'all. Hopefully y'all can.
Yes, I can see.
Okay, perfect. So guys, what do you think the problem is? When we look around, like I said, I've been a dietitian for 19 years. The last 5 years of my career, I spent in nephrology sales, meaning I went to nephrologists, and which are kidney doctors, and I went to dialysis clinics to talk about a medication called a phosphate binder that people on dialysis need in order to live. Okay. And throughout those 5 years, nothing hurt my heart more than passing these hospitals and these clinics that are completely full. For those of you who have no family or friends on dialysis, you probably have never seen a dialysis clinic in your neighborhood. But if you do know someone that is on dialysis, or a friend or family, and you know where their clinic is, you are going to be surprised, because there are clinics on every corner. I can't even tell you how many dialysis clinics that I covered within the top half of Georgia. I probably had over 100 dialysis clinics just in like the top half of the state, the top west of the state. And these clinics had on average of 100 patients. For those of you who don't know, when you are on dialysis, you're on it for life, either till you die or till you get a kidney transplant. And the two main causes of dialysis are diabetes and hypertension. The problem that we have as a nation, as a world, are food problems. They're dietary diseases. They're not diseases caused by a lack of a statin or a lack of a blood pressure pill. For those of you who believe in God, God did not create us to have to rely on medication to be healthy. So we have a huge problem, okay? Why is my screen not moving? There we go. We have a huge problem. 93% of our country is sick. I want y'all to grasp that number for 1 second. What that means is 7 out of 10 people in the room with you are sick. You can't help but look around. And once you are aware of these things, if y'all want to put in the chat, how many of you, once you see, you can't unsee? You're like, oh my gosh, that person has insulin resistance. Oh my gosh, there's someone else with insulin resistance. And on top of that, 50%, half of our country has prediabetes. Y'all, we have a big problem. And here's the ironic thing. There is more medication than we've ever had in our lifetime. More doctors. There's ear doctors, hair doctors, nose doctors, eyes doctors, heart doctors, toe doctors, fingernail doctors. We have all this new testing equipment. And what do we see happening? Amanda just talked about it. We have a trend like this of illness. So we're missing the problem, right? It's not lack of medication. But I want you, for those of you who are new, to think about something for a second. Think about yourself. Do you crave sugar? I'll be the first to admit I am a sugar addict, okay? But this system has really helped me manage that. How many of you have migraines or know somebody that has migraines? Are you constantly hungry? Think about it. Are you thinking about what you're having at your next meal while you're finishing your current meal? That used to be me. I'm like a bottomless pit. What about skin tags? How many of you have seen people standing in line in the grocery store with you, and it looks like you're like, their neck looks dirty. They may need to take a bath. That isn't dirt. That's skin pigmentation due from too much insulin. So are those skin tags. The dermatologist cannot freeze those off. They are going to come back. That protruding belly that we giggle about as a dad bod, that's nothing to giggle about. That is some of the most dangerous fat that one can carry, because that is hard, deep fat that surrounds your organs. Okay. Are you bloated? It's not just these things, but how many of you stay bloated? How many of you have IBS? Guys, IBS is just a generic term for, we don't know what's wrong with you, but you've got some gas, bloating, diarrhea, or constipation. So we're just going to generally call it irritable bowel, right? Well, then we all have irritable bowel. Inflammation. How many of you have achy joints, right? When you stand up, when you sit down, the toilet's the worst, right? Guys, we all have to sit on a toilet. We need to be able to do it and not hurt. Headaches. How many of you find that you pop Tylenol or Advil constantly for headaches? How many of you have brain fog, skin problems? How many have you been told that, I remember as kids, if you eat chocolate or you eat greasy food, you're going to have acne. Well, it wasn't the grease. It's the sugar. It's the flour. It's the inflammatory seed oils. These autoimmune conditions that are on the rise. I was sitting next to a lady on the airplane this past few days, and she was telling me that her 2 daughters both have, I don't know, 2 or 3 children apiece, and all of them are extremely, well, I take that back. The 2 children that were delivered by C-section, and then one was a vaginal birth that was not induced. It was all natural. That all natural child that had no induction or C-section had no autoimmune issues. The other 2 children, terrible eczema, psoriasis. But I asked her a question. I said, were your grandbabies breastfed or formula fed? And she said formula fed. So for those of you who have grandchildren or children, I want you to take the can of formula and I want you to turn it over and I want you to look at the ingredients. High fructose corn syrup and corn oil, soybean oil. These are highly inflammatory ingredients. So there is no surprise to me that these children that were formula fed are dealing with severe autoimmune conditions. Okay. Now I know sometimes we have no choice, but we've got to figure out a way to get better nutrition into these infants. All right. Mental health. We really don't talk about this enough, but I will tell you there's some promising new data coming out on a ketogenic diet and schizophrenia and bipolar and anxiety and depression. ADD, ADHD, it's profound, guys. It's so promising. Gestational diabetes. The good thing is this protocol is safe for pregnant women, and PCOS and erectile dysfunction. Those are issues that I think we silently suffer from because they're kind of embarrassing to talk about. But let's talk about the standard American diet. These little lines look like your daughter got your eyeliner pen and went to town on the paper towel, but that's not the case. This is us, okay? This is our glucose and this is our insulin. So as a dietitian, I'm apologizing publicly because I told you wrong for so many years, but I'm here to tell you the right thing now. We don't need to eat every 2 to 3 hours. This green line is the line of somebody who eats every 2 to 3 hours. You eat breakfast, you wake up, you walk like a zombie to the kitchen, you make your orange juice, you have your oatmeal, you have your bagel, you have your cereal, and your glucose goes straight through the roof. What happens is insulin follows that. That's normal. That's what is to happen because you only need 4 grams of sugar in your system at one time, okay? What we eat has far more than that. So the body wants to get it out of the bloodstream. So we release insulin, okay? That red line is insulin. Here's the thing. When we eat every 2 to 3 hours and we eat these high carbohydrate, high sugar meals, insulin doesn't come down. It takes about 4 hours. So we live in a state of too much insulin, okay? And when we have too much insulin, we cannot burn fat. That shuts off any possibility of fat burning. So what happens, right? Well, we know what happens. We just talked about it. Amanda talked about it. All of these conditions happen, and they come from high insulin levels that happened 10 to 20 years before these conditions popped up because the body is amazing and it will do whatever it needs to do to correct itself. So what do? We don't want to take all this medication because we just have seen medication's not the answer, okay? But there is an answer. So if too much insulin is the problem and eating sugar, so guys, when I say eat sugar, carbohydrates are sugars holding hands, okay? Starches are sugars holding hands. So fruit is a sugar. Yes, it has fiber in it, but it's still a sugar. Pasta, bread, oatmeal, rice, crackers, okay, baked goods, all of these are sugars. So if we eat sugar, what happens to our blood sugar? It goes up. You eat sugar, you put sugar into your system, it's going to go up. So think about it. I bet every one of you know the answer to this. So to bring it down, what do? We don't eat sugar. Ding, 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 right? That's just, how can it be that simple? You just don't eat what caused the problem. I tell my folks when I'm doing lives, I want you to think of it as you have an allergy to carbohydrates. If you have type 2 diabetes, you have a carbohydrate allergy, okay? Just kind of a way to think about it. But if we don't eat and we start skipping meals, called intermittent fasting, and here's the beautiful thing. I don't mean eat less. You don't even have to change anything you eat. But if you condense your eating window and you cut out the snacking, studies show every marker of metabolic health improves. Y'all, that's profound. Okay? And when insulin comes down, those fat cells start to give up some of that energy. You start burning those love handles. So if you wake up in the morning instead of eating breakfast, maybe you don't eat. Maybe you have a unimate, okay? What is this? This is an amazing chlorogenic acid concentrate. Guys, we don't need to go into all the science. The easy takeaway from this is this little pack of magic right here shuts off the food noise. It makes fasting easy, and it helps you be able to avoid the foods that are so highly addictive those that call our name all hours of the day, and especially at night after dinner, right? But if you can shut it up, it's much easier to avoid it, right? So this gives you great energy. It is what I drink for breakfast. I drink another one in the afternoon. It increases your cell sensitivity to insulin. Why is that great? Because the more sensitive your cells are, the less insulin you need. It helps lower blood pressure. I'm sure many of you on here have high blood pressure. This helps lower blood pressure, and it helps lower inflammation. And then before your biggest meal, you consume this little pack of fiber, which actually lowers glucose more than metformin. So you can either have one in the morning, another one in the afternoon, and then you're balanced before dinner. It does not matter how you do this protocol as long as you use it, right? So you may want to eat one meal a day, do your 2 teas, and then have your one meal with your fiber. Maybe you have 3 meals in a smaller eating window and you do your teas and your fiber. You're just going to take your fiber before your biggest meal to lower that glucose response. The teas are going to help eliminate the snacking, give you great energy, and clear the brain fog. Now, you heard me say take this before your biggest meal. For those of you who have heard of metformin, it's a diabetic drug, right? We take it to lower glucose. Well, this little pack of all natural plant fibers has the ability to lower your glucose more than metformin. Metformin lowers glucose about 25 to 30%. This little natural pack of fiber lowers glucose 34 to 37%. Guys, that's pretty profound. That an all natural supplement that not only lowers your glucose, but it improves your gut health. It is the food for your gut bacteria. It helps you get fuller faster. I saw a comment earlier that they get full and don't feel hungry. Listen to your body. If you use the balance and aren't hungry, more power to you. You'll burn your love handles, okay? Now, the tea, anybody heard of semaglutide, Ozempic, Wegovy, Mounjaro? I'm sure, unless you've lived in a cave, the last few years you've heard of these drugs, right? They're given to shut people's appetite off, to stop the food noise, to help you eat less. This little natural pack of tea upregulates our own GLP-1. Our body makes it, guys. It just makes it small. This increases it by 60 to 70%. So we get the benefits with 0 side effects, okay? So when you first start this, y'all, sugar is a drug. It's just a socially accepted drug. So when we cut it out, we might feel physical withdrawal, okay? We might feel like our body is detoxing. That just shows you that it really has power over us, okay? You might get lightheaded. You may get dehydrated. You may have some cramps. Those are electrolyte imbalances. You may notice that you pee a lot. That's because your kidneys are releasing salt. You may notice your stomach grumbling. That's because ghrelin's talking, okay? These are signs that it's working. These are signs that your body's detoxing, okay? But if you stick with it, your glucose is going to come down, which means your A1C comes down, which means your insulin comes down, which means that you will burn body fat. You will notice that your tastes change. You don't crave the things that you used to crave any. You will start to look for good, healthy, nutrient-dense food, animal-based proteins, high-fiber vegetables, good quality fats, okay? You'll feel satiated very quickly without thinking about your next meal. You sleep great. The inflammation goes down. You might notice that your belly is flatter because all of that bloating is gone. Your triglycerides come down. You heard Rob say 3,000 to 1,000 to a little over 100, right? Your blood sugar gets better. Your blood pressure gets better. You think clearly. Your energy is better. Guys, these are all things that we hear. So let me ask y'all, for those of you who are on this call, do me a favor, write 1 or 2 comments in the chat of what your experience has been since you started the system. Now, don't, make it like this big if it's only this big. Let's just be honest. Let's tell what it's done. I want the new people on here to see that the things we are saying are not too good to be true. For myself, when I started, I didn't need to lose weight. I didn't have high blood pressure. But what I did have is something that was not written on my forehead, but my triglycerides were through the roof too, like Rob's. Mine were 250. And 8 weeks on this system, mine went from 250 to 50. That's profound. Okay. And then my good cholesterol, which you want above 55, was at 53 and it went to 122. So I want y'all to see, I'm going to try to bring up, let me stop sharing and get back on here. And I want to read a couple of these out loud, and then we are going to address some of the questions. All right. Let's see. Down 60 pounds, triglycerides went from 150 to 70. Food cravings way down. No bloating, 30 pounds down in 4 months. Reversed fatty liver and type 2 diabetes. Lost weight in inches off all medications. High blood pressure, no more pre-diabetes. Down 88 pounds. I can't even keep up. Lost 100 pounds. No more diabetes. Off metformin after 20 years. Triglycerides went from 200. Let's see. Oh my gosh, I can't keep up. Lost 8 pounds. Headaches gone, no bloating, lower triglycerides, lower cholesterol, 11 months off this on the system, off all meds, IBS gone, AFib gone, down 87 pounds, reverse diabetes, down 25 pounds, 79% less.
We're getting ready to go to bed in about another about 10 minutes, okay?
Anyway, guys, y'all can see that so many people's lives have changed by using this simple protocol. And the beautiful thing is it's all natural. There's no interactions. It's not going to interfere with your medications. It's just food. You get a 90-day money-back guarantee. So if what you're doing is keeping you stuck and you're not getting better, give this a try. Reach out to the person that invited you here and try something different. Amanda, if you want to come back on, guys, if y'all have any questions, I'm going to bring Amanda back on with me, and she will be here to answer any questions. Amanda, did you see any? Let's see. I have a question. Ingrid, if you want to type your question, or I can let you come on. Let's see.
There's a question in there. My menopause caused me to gain a lot of weight. I'm so tired of this weight. So I'm in menopause. Yeah, I'm 56 years old, and I have been struggling with the midsections and the brain fog and the hot flashes and the hair loss. I would have been able to shrink my love handles, lost 15 pounds, and able to keep the weight off. And no more hot flashes. So there's hope here.
Yeah.
And I'm not unique either.
Yes, yes. I see a couple questions. This does not break a fast. Black coffee does not break a fast. Heavy cream does not break a fast. Type 1 diabetics can use this. It will lower your insulin need and help increase your cell's sensitivity to insulin, which we want to keep your cells super sensitive. Sucralose is being faded out. Somebody asked, why is Splenda in this? It's only in the lemon ginger, and it is being phased out. You should see that completely gone. That is the only product left that is in, and it will be gone within the next couple of months. The sweetener that we are using, I see some questions about the sweetener, is stevia. It's all natural. And the reason that we use stevia is because we are available in 60 countries. We have to find a natural alternative that is approved for all of these different countries, okay? Do people see results with their thyroid, Ted? Absolutely. I missed the start. Ashley, if you want to post the name of your condition, benefits to lupus. Yes, because it's an autoimmune condition. So if you lower inflammation, you see benefits. Amanda, if you see some, feel free to jump in.
Yeah, it's my brother is starting dialysis soon. Can he be helped with these products, or is it too late? It's not too late.
Yeah, I can speak on that because I'm worked in dialysis. Kathleen, we can't say, I can tell you this, it's not going to hurt. I work with a bunch of nephrologists now that send me their kidney patients, and I've seen some significant improvement. So all I can say is, why not give it a shot? It's going to only benefit him. It's not going to make anything worse. And I would do anything possible to slow down that. Here's a question, man. I'm skinny diabetic and don't need to lose weight. How can I shrink my midsection? I didn't lose weight, but if you have a big midsection, that's usually visceral fat from high insulin levels. So if you cut out the ultra processed food, focus on animal proteins, good healthy fats, and incorporating this system, you will see that visceral fat go away. That's the hardest fat to get away from, to get rid of. Incorporate some resistance exercise as well. Amanda, do you see any? Let's see.
Yeah.
Let's see. Stevia. Yes, Rhonda, it's a very high quality stevia. It's not the processed kind that you get in the grocery store. So with liver failure is one thing, but fatty liver, this is a beautiful tool for fatty liver. Beautiful tool for fatty liver. Fatty liver responds super quick to cutting out carbohydrates, ultra processed foods, and seed oils. Intermittent fasting, extremely low carb diet, and the Feel Great system, and you will see a fatty liver shrink really quick. Okay. Bone broth. I think bone broth is amazing. Bone broth protein's amazing. Let's see. I'm needing medications. So Jamie, if you need medications with food, I would if possible, move your medication to your first meal. If you can move it back. Or you could even take it with a tablespoon of chia seeds and water, or even mix up a little balance and take it. So guys, I am going to have to make that our last question. We want to end on time for people and be respectful of your time, but we so much appreciate all of you coming on and asking your questions and being a part of this community here. We have these calls every Tuesday night at 9 p.m. Eastern. We have different topics. All of us are so very passionate about educating and about telling people that you do have other options. If you're new here and want to give this a try, please reach out to the person that invited you. Amanda, I just want to thank you so much for giving your time and your expertise on medications, because goodness knows we had a lot of people on medicine that hopefully by following this protocol will start to be able to come off. But thank y'all so much. And we will see y'all next week.
All right. Thank you.